As an Oregonian, I talk a lot about the ways that the Trump regime is actively harming my state, especially the red rural counties in my state. Now, if you're not from Portland, you may be unaware of the fact that if you leave Portland, the state gets very red very quickly, especially the further you go toward Idaho and the further south you go. I used to live in a very, very rural part of Oregon. I have tremendous affection for rural Oregon, and I'm always frustrated at the ways that rural Oregonians seem intent the last several years to vote for leadership that is only going to further reduce their quality of life. Rural Oregon is struggling, much like the rest of rural America. I understand things are not good in rural America. That's why so many people voted for Donald Trump, because he told them he was going to make America great again. He was going to bring them back to a time of prosperity. We see rural communities that are watching their populations decline. They are watching their economic prosperity decline. These are communities that don't see the American dream as being accessible to them. These are communities that don't see any progress for their little corner of America. And a man came in and said, I'm going to fix all of this for you. I'm going to make it better. I hear you. I'm listening to you when you tell me that you are suffering, you are struggling far harder than you should have to. So they voted for him. Now, he lied to them, right? He said he was going to make America great for them. No, he only meant that he was going to make them suffer even more and make America great for him and his billionaire buddies. I know it's very easy to say that red rural America is the tree voting for the axe, but you have to understand people are really struggling and they have been lied to. They thought they were voting for their future prosperity. And now they are coming to realize in so many ways that Donald Trump is just going to make their lives even more difficult. He is going to make them struggle that much harder. He's going to push the American dream further and further away from rural America. And one prime example of that is the big, nasty, bloated bill. I think my congresswoman calls it the big betrayal, where Republicans fully admitted that it would mean giant cuts to Medicaid. It would create tremendous hardship for rural Americans when it comes to accessing health care. But they were like, sorry, our loyalty is to Donald Trump, not to our constituents. Our loyalty is to a fascist regime, not to the American people. And so Republicans crammed all of that through, ballooning the debt, trillions of dollars, tens of billions of dollars for ICE to round up our immigrant neighbors, and then giant tax breaks for the super, super rich, all while taking away health care from 14 million Americans. And for millions and millions more, making their healthcare go up significantly. And then also closing clinics and hospitals all around the country. Red rural counties will be the most impacted by the sweeping cuts to Medicaid that will result in clinic and hospitals shuttering their doors. It's already happening. And once again, we have a story in the headlines about how what is happening in rural Oregon is very much reflective of what is happening across rural America. This is a piece by Danielle Dawson from September 22nd in the Oregonian. It's entitled, Maternity Ward Closure in Rural Oregon Signals Wider Threat Amid Looming Medicaid Cuts. It is quite a long piece. It is not behind a paywall, so I encourage you to go read the whole thing. The article begins with a story from a woman named Tila Bannister from Baker City, Oregon, which is a town of about 10,000 people in a county that went for Donald Trump. And when I say that Baker County went for Donald Trump, 72.83% of the voters voted for Trump in that county. So Tila is pregnant. She's in labor. She can't go to the little rural hospital 15 minutes away from her house because they closed their labor and delivery unit back in 2023. This meant that Tila and her husband would have to drive to La Grande, and she was quite worried that they wouldn't make the long drive and she would end up having her baby on the side of the road. That's precisely what happened about 20 minutes into their drive. She had her baby on the side of the road. Her baby was born not crying, not making any sounds. Now, luckily, they were able to get to the hospital in La Grande and doctors were able to treat her child and there were not any further complications. This story really resonated with me because my third child was born at a rural hospital in Oregon, more than an hour from my home, and I also was worried I was not going to make it to the hospital in time. I left basically after the first contraction, and the whole labor was less than 3 hours long. If I had waited, I would have had my kid on the side of Highway 101. But this is what is happening all across rural America. People don't understand the way that Trump's cuts to Medicaid Republicans' cuts to Medicaid are going to be closing clinics and hospitals all over this country. There already was a shortage in rural America. And having to drive a long distance to have your baby or to get to an emergency room can mean the difference between life and death. One woman who was interviewed for this story said that she relocated her family to Idaho because she had to have a scheduled C-section, and the hospital in Baker City was no longer offering maternity care. Now, Baker City lost their maternity ward in 2023, but what is happening and has been happening in that community for almost 2 years is a glimpse into what is going to happen all across this country if these Medicaid cuts are allowed to stand. We are seeing right now Democrats who are saying that Republicans are going to shut down the government if they don't give back the Medicaid cuts, if they don't prevent the closure of America's rural clinics and hospitals. That's on Republicans. They own that. They voted for these terrible, terrible cuts, crammed them down the throats of the American people, knowing it would be bad for their constituents, knowing that it would cost millions and millions of people their health care. 40% of America's pregnant people are on Medicaid. 41% of America's children at any given point in time are on Medicaid. Closing clinics and hospitals that rely on Medicaid funding impacts everybody, whether or not you have health insurance. In Oregon, 1/2 of all births are covered by Medicaid. What happens when patients lose their coverage? What happens when clinics and hospitals shutter their doors? You end up with more dangerous pregnancies, and you end up with higher rates of maternal and infant mortality. I think a lot of Americans didn't realize that rural hospitals were already operating on the margin. A lot of them were functioning in the red, and it was only Medicaid dollars that were keeping their doors open. According to a report by Investigate West, over 3/4 of Oregon's hospitals have been functioning in the red or operating within a margin of 3% or less. Rural hospitals are particularly vulnerable because they see fewer patients. They don't have the kind of highly specialized services that larger hospitals in cities have, and so they don't have those more, unfortunately, financially lucrative sources of revenue of kind of care that is provided in those locations. And so they operate on a much smaller margin than a big hospital in the city. A high proportion of patients on Medicaid is an indicator of a hospital's financial vulnerability. And we know rural hospitals take far more Medicaid patients, and Medicaid reimburses 56 cents on the dollar. So already it's not a great reimbursement rate. They're already very vulnerable. And then Donald Trump and the Republicans want to yank that funding. So Senate Democrats used this metric when they put out a letter in June identifying a list of rural hospitals across the country that could be financially devastated and be subject to service cuts, either closing whole departments like obstetrics or closing their entire hospital. There are 4 hospitals in Oregon that were in that letter. I think it's more than 300 hospitals across the country. If you're an Oregonian, Providence Seaside is on that list. Obstetrics units do not make money, explained Dr. Katie Kozmaniel, a professor of health policy at the University of Minnesota. When the bottom falls out from Medicaid financing at a small rural hospital, you can't keep maintaining a unit that was already operating at a loss. Now, please don't be fooled. Republicans know that this is deeply unpopular, that it's going to result in people dying in their districts. They don't want to go against Donald Trump. That's why they pushed this through, even though they knew it was the biggest Medicaid cut in history, even though they knew hundreds of hospitals would be closing, even though they knew it would negatively impact your life. So Senate Republicans are now saying they're going to give $50 billion to provide immediate relief for rural hospitals. Do not believe this. RFK Jr. and Dr. Oz say they're going to use that money to expand technological tools and initiatives to tackle the root causes of disease. Yeah, RFK Jr. is going to use that money however he wants. He's not going to use it to keep your hospital open. And even so, it is a Band-Aid on an amputation, said my Senator Ron Wyden. It is a little drop compared to the total amount of money they are taking away from Medicaid. Not to mention, it doesn't give Medicaid coverage back to the 14 million Americans that they're snatching it away from in order to give tax cuts to billionaires. Please understand, Republicans and Donald Trump are making red rural America less safe, less prosperous. The regime is taking and taking from rural America so that they can give to the super rich. Nothing Trump is doing again is making rural Oregon greater. Nothing Trump is doing again is making life better for the working class anywhere in this country. And as we watch more hospitals closing their doors, it's going to get far worse.